Hi, welcome back to MJ Physio's YouTube channel. In the previous videos, we talked about sciatica and its causes and symptoms, and then in the next video, we discussed about how long the sciatica lasts, and in the final last video, how to differentiate between the lower back pain and sciatica. If you haven't watched those videos, the video's link has been posted in the description below, so please do click and watch and come back and watch this video again. So in this video, we are going to talk about the risk factors of sciatica. So we generally know sciatica can start with something as a minor occasional dull or mild pain in one leg or on the other side of the body. The nerve related condition may experience numbness, tingling, sensations and local or radiating pain. The nerve length which turns from the lower back into legs branching off into the small nerves causes the symptoms to be varied. Generally, the main risk happens due to the age-related spinal changes. Over the time, the change to the spine, its supporting tissues, can contribute some of the degree of the disc damage. If the parts of the spinal disc break off, the sciatic nerve can become irritated or compressed. You can't stop the natural aging process, but you can make some effort to exercise regularly, eat food which is rich in calcium, B vitamins, magnesium, vitamin D, vitamin K and other nutrients for which keeps the spinal bones and tissues and nerves really healthy. So avoid or quit smoking and alcohol consumption if you are above 50 plus. And the risk is excess weight. Extra weight can place added pressure on spine, its supporting tissues, joints and the sciatic nerve. If an inactive lifestyle is also a part of equation, the spine supporting muscles can become weaker over time, which can place additional stress on the spine and its nearby parts. And the next is diabetes. Long-term diabetes affects nerve sensitivity and functioning. Progressive nerve damage may eventually affect the sciatic nerve enough to make it more susceptible to irritation and inflammation. The risk of higher diabetes who can't effectively control their blood sugar levels. So try to control your blood sugar levels regularly to safeguard yourself from risking of sciatica. So the next is spinal injuries. Sudden trauma or injury directly affecting the spine may cause an invertebral disc to rupture. Some injuries of this nature can also cause vertebrae to shift and the tissues to swell. This resulting the damage from spine injuries may place some pressure on the sciatic nerve, which might trigger the symptom to affect the part of the backbone. So make enough measures to make sure you don't get much spinal injuries. Next the risk is spinal stenosis. Spinal stenosis is a narrowing of spinal canal. Many people have this condition with a little or no symptom. However, if the narrowing increases over time and it affects the lower spine, the sciatic nerve could end up being compressed because of spinal stenosis. And the final thing is daily work-related movements. Whenever it's repeated bending, reaching or twisting or performing repetitive movements involving the lower back pain, there are many daily movements that could affect the sciatic nerve. There are also evidence suggesting sitting for long periods can contribute to sciatica as well. Not all movements related to your daily work-related routine can be avoided entirely, even though not all movements related to your work can be avoided entirely, but there are such things which you can avoid of excessive lower back stress, like that may affect in the sciatic nerve. For example, like use a proper lifting technique when you are bending your hips and knees to avoid twists and turnings while lifting something, and straighten your legs as you may lift. So minimize your repetitive lower back pain movements as much as possible. Use lumbar supporting braces if you have to do your work involving such lower back movements. Shift your positions and sit. Use an designed chair. Shift your position as you sit or used a specially designed chair to ease your stress or muscles around the sciatic nerve, and watch your posture of, as you sit or stand and sleep. So these are the major risk factors which affect the lower like sciatica, which affects the sciatic nerve. It may cause excessive pain. So hope you all have a general idea about the risk factors for sciatica. Thank you all for watching this video. Please do like, share and subscribe to the channel. Thank you.